After I had my stem cell transplant, I developed graft-versus-host disease, which, among other things, caused an incredibly rare complication called Thoracic Air Leak Syndrome, which facilitated the complete destruction of my lungs. GVHD, or graft-versus-host disease, is a complication that can occur after receiving a stem cell transplant from a donor, which is called an allogenic stem cell transplant. These stem cells are transfused into the recipient where they make their way to the bone marrow and proliferate and differentiate into the various different blood cells of the human body. So essentially they're constituting a brand new donated immune system. These new white blood cells travel through your body, through blood vessels, and seek out pathogens and different microbes that they need to wipe out that usually cause infection. The problem is they can now target healthy tissues and attack that as well. Hence the name graft versus host. Graft being the donated stem cells and host being the recipient of those stem cells. Okay, so what's my experience with graft versus host disease? I was in the hospital for about a month after my stem cell transplant. I would say about 2 weeks in, I developed mouth sores so bad that they had to feed me through my Hickman catheter. And it was something called TPN, so total parenteral nutrition. Unfortunately, the GVHD did not stop there. I had a skin rash from head to waist and diarrhea so bad that I had to poop in a plastic hat thing in the toilet and measure, well, you get the point, just to make sure I wasn't losing, enough fluid that I would just become dehydrated. Be serious. So fast forward 6 to 7 months, I'm out of the hospital. Life is somewhat bearable. I've recovered a bit. And I kid you not, overnight, I go from being not even noticing my breathing, it was fine, to waking up and not even being able to get up a flight of stairs. I'm talking about 5 or 6 steps. GVHD had slowly been damaging my lungs up to that point without me even noticing. Despite the doctor's attempts to give me high dose immunosuppression to try to knock this down, I kept deteriorating and it reached a culmination in the summer of 2018. I go in for a bronchoscopy so they can investigate what's going on. And afterwards, I don't know what happened, but I got hit with a bunch of different infections. Pseudomonas, I might get these wrong. Pseudomonas aeruginosa, Aspergillus fumigatus, and Mycobacterium avium complex. For this entire summer, I'm in and out of the hospital and doing IV antibiotics. So at one point I'm at home doing IV antibiotics. They don't seem to be helping much. And I wake up one morning, feel my neck, it's really tight. And I can kind of tell it's swollen, and I feel my neck and it's like there's Rice Krispies underneath. So when I press down, there's a popping sound. Yeah, it was that moment where it's all right, back to the hospital. I have no idea what this is. So I'm back in the hospital at this point, and my doctors discovered that I have developed something called Thoracic Air Leak Syndrome, which is an incredibly rare complication and can present in many different ways. This is a complication that can occur after an allogenic stem cell transplant, so getting stem cells from a donor instead of using your own stem cells. So thoracic air leak syndrome can manifest in a few different ways. For me, it was something called subcutaneous emphysema. So this is kind of how the doctors described it to me. The structural integrity of my lungs were so compromised that I was literally leaking air from my lungs into my soft tissues. So this would be my neck. It started going up my face, on my chest, and then even down my arm near the end. Thankfully, in my situation, it's not too bad to treat. All I had to do was go into respiratory failure, get airlifted to Toronto General Hospital. What else was there? Endure, I think it was 2 nights of a drug-induced hellish nightmare. Go to respiratory rehab for 2 months, and then a double lung transplant. And then I was good to go. But I guess that's a video for another story.
What?
Hopefully this video was a little entertaining and informative. If I had any advice for anyone facing this situation, I would just demand your doctors do pulmonary function tests every month. It can make all the difference If you like this video, please consider sharing and subscribing.